Hello, my name is Dr. MarkAlain Dery, and I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana, the largest Medicaid providing clinic system in Louisiana, and I'm co-chair of the ACOI Infectious Diseases subspecialty section. Along with the leadership of the ACOI, we want to thank you for all that you have been doing as we face this unprecedented time in medicine fighting the COVID-19 virus. Moving forward, and in conjunction with the ACOI, we want to share with you some valuable information as it becomes available, as well as some bright spots that we are seeing so we all can feel some hope in these trying times. So let's talk about something that's been in the news a lot, and that has been the correlation, or at least the association, between Kawasaki disease and COVID-19. One of the things that we've seen from the beginning of the coronavirus crisis is that children somehow are not affected or less affected. And this has, of course, been a rare bright spot during all of this. And thus far, it's been a very different story than another public health emergency that swept the world in the early 20th century that seemed particularly aimed at children. And this is, of course, the historic polio epidemic. And it scared a nation so much that parents willingly volunteered their kids by the millions for the field trial for an unproven vaccine. So today, as we are just getting comfortable with the conclusion that the coronavirus, for the most part, spares children, we are possibly seeing yet another scenario emerge. And as with so many things with this virus, we're discovering new characteristics and symptomology almost daily. So in certain areas of the country, kids are being increasingly admitted to hospitals, critically ill, with an unusual illness that is thought to be linked to COVID-19. Now, it first cropped up in Europe last month and is now being seen in New York and other hotspots around the country. And children are coming in with symptoms from reddened tongues to rashes to enlarged coronary arteries, and this is essentially being referred to as a pediatric multisystem inflammatory syndrome. Now, it's less lung specific than coronavirus, and few kids have actually ended up on ventilators. In some patients, the syndrome actually seems similar to a rare childhood disease called Kawasaki disease, which can lead to inflammation of the blood vessels, especially the coronary arteries. Now, Kawasaki disease, which is a pediatric inflammatory condition, is considered rare in our country. And the good news is that no child has yet died, and they appear to be responding well to treatment. If left untreated, however, it can lead to serious heart conditions and coronary aneurysms. So these cases are strangely now more frequently popping up all over the country, and doctors in New York have noted that cases of the new syndrome began to appear about a month or so after a surge of COVID-19 in the region, leading to the conclusion that it may be post-infectious immune response to COVID-19. In California, a 6-month-old baby girl that came in with classic Kawasaki disease tested positive for COVID-19. And the treating doctor subsequently published a case report about that incident, and there are similar reports that have now since come out from the UK and Italy and in Spain. But while in New York, 15 of those cases, 4 turned out to have positive test results for COVID-19, and 6, interestingly, tested negative, but they tested positive for COVID-19 antibodies in their blood, suggesting that they had recovered from it at some point. Again, interestingly, while otherwise healthy children are falling gravely ill with this new syndrome, they are still, fortunately, far less at risk from what adults are facing from COVID-19. And like so many things associated with this virus, we still don't understand the relationship between Kawasaki and COVID-19. It may be kickstarting the Kawasaki-like inflammatory processes in children, since many doctors already think that the disease is typically triggered by viral illness. And as I say almost every day, this disease process, COVID-19, the SARS-CoV-2 virus, and learning about it on a daily basis does remain a truly humbling experience. So, sticking with my recurring theme that we seem to be learning more every second about this virus, it seems that a CDC report has surfaced in recent days that showed a projected daily death count in the U.S. doubling by June 1st, in addition to spikes in daily infections. And another model from the Institute of Health Metrics and Evaluation projects 134,000 COVID-19 cases projected by August 4th. Now, regardless, these projections all amplify the primary fear of public health experts that reopening the economy will put us as a nation right back to where we were in mid-March, when states found themselves with no choice but to close. Now, that is of particular interest now, as nationally 27 states have loosened social distancing restrictions in some ways. And as of Monday, yet only 20 have actually met the caseload or testing criteria guidelines set up by the federal government. The other 7 are still showing a rise in daily infections and positive tests, but they have still chosen to reopen anyway. In New York, cases are declining, and Governor Cuomo there announced an effort to monitor 4 core factors to determine if regions within the state are ready to open. And those are the number of new infections, the capacity of the healthcare system, the testing capacity, and the capacity for contact tracing to identify people exposed to those who test positive. Now, I believe that we need to be vigilant here, and we need to be smart as to how we open the economy back up again. This is not an if sort of thing, it's more a when sort of thing. Because as the country begins to open in the fragmented manner it appears to be doing, and given that the CDC estimates are correct, then this means that us, as healthcare workers, will be affected. We will be on the front lines again, caring for those with COVID-19, with the possibility of continued shortages of PPE and ICU beds and hospital staff. Vigilance, right? We need to be vigilant, and we need to talk to our community leaders and our business leaders and our lawmakers to help them see the direct line that opening the economy has on us and our fragile health system. Okay, this is my favorite segment. Let's talk about some sweet news. We actually have 2 great stories, so I want to end with some news that I find particularly sweet. There is a special 5th grader in South Dakota who loves to write letters, and who knew with all the electronic devices out there that kids actually write letters. And she did something that we all need to remember to do more frequently, and that is to show gratitude. So not only did she make her postman happy when she took the time to write him a thoughtful thank you note for doing his job and sending all the letters as she writes, but he was so touched that he gave her a thank you note right back. And so did his supervisor, and the supervisor submitted the letter to the U.S. Postal Service newsletter, and other postmasters general all over the country began sending her thank you notes. And it turns out they appreciated being seen and thanked, since many times it is a lonely and thankless job. Then Twitter blew up when her dad posted his daughter's letter, and it seems like everyone loved her spirit of gratitude, and it humbled me. So what a reminder that we can all take steps of showing gratitude and love. So in another display of gratitude that I read about is from Ireland. Over 170 years ago, Native Americans in the U.S. heard about the potato famine in Ireland, and it spurred the Choctaw Nation to raise and send $170 to the starving Irish families suffering through that disaster. And today, that is equivalent to about $5,000. Now, it meant so much to the people of County Cork that a beautiful sculpture stands in a park there to commemorate the generosity of the Choctaw Nation. So let's fast forward to today, and as is well known, the Native American populations here in the U.S. have been hit particularly hard by the coronavirus, and the Irish, it seems, don't forget a good deed. So to repay that kindness, hundreds of Irish people have recently contributed to a fundraiser to help supply clean water, food, and health supplies to the people of the Navajo and Hopi Reservation, suffering during this COVID-19 pandemic. Since the onset of this fundraiser, more than $1.8 million has been raised and sent. And I just want to end on the fact that I actually lived on the Navajo reservation for almost 4 years as part of my public health service duties as a young medical officer. And so that last story was meaningful to me. So stay on the lookout for our regular updates, and to read more from the sources used in this report, go to the acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of this crisis. Please feel free to reach out to me anytime at madery@mac.com. Please stay safe. We can do this together.